I'd like to invite our next presenter. If I can have Bethany Rickard come forward, please. Thank you for joining us. You have 5 minutes for your presentation, 5 minutes for question after, and you may begin when you're ready.
Thank you. My name is Dr. Bethany Rickard. I'm a family physician living and working here on the ancestral territories of the Snuneymuxw people. Working with patients in our community and in rural communities in northern BC has highlighted to me how critical it is to have a healthy environment in order to have healthy people. There are many ways I could ask the province to fund that intersection, from electric cooling in homes to conservation of critical ecosystems. But given the limited time today, my top priority is to ask the government to work with industry to fund and require an independent, comprehensive, cumulative health impacts assessment of the LNG and hydraulic fracturing industry. This call for a health impact assessment of the LNG industry is growing stronger across the province. The Health Officers Council of BC, an independent body of over 130 public health physicians, adopted a motion last fall to make this call to the province. 4 frontline municipalities across BC that are directly affected by LNG expansion have also passed similar motions: Squamish, Hazelton, Terrace, and Dawson Creek in the heart of fracking country in northeastern BC. I would like to share with you some stories from my own patient encounters and from colleagues, highlighting some of the harms associated with LNG and fracking. Fracking causes direct health impacts to people living nearby: increased rates of miscarriages and birth defects, certain cancers, heart attacks, strokes, asthma, mental health disorders, and overall preterm death. A family physician colleague in Dawson Creek told me about her 8-year-old patient with leukemia who was one of 3 children in the same class with cancer. A local radiologist there diagnosed 10 glioblastoma brain cancers, more than he'd seen in his prior 30 years working in Cape Town. This fatal cancer has an average survival time of 1 year from diagnosis, and many of these cases were unusually in young patients in their 20s and 30s. There are reports of unexplained neurologic symptoms in farmers living near gas infrastructure and digestive tract cancers in young oil and gas workers themselves. Beyond fracking, air pollution from flaring at LNG export terminals spews harmful air pollutants like volatile organic compounds and particulate matter. I practice as a visiting locum in Kitimat, and I've heard reports directly from patients of chronic unexplained coughs and increased inhaler use since LNG exports started in Kitimat 1 year ago. In Kitimat, levels of nitrogen dioxide and sulfur dioxide already exceed Canada's recommended limits, which affects vulnerable people, such as those with lung diseases, pregnant people, children, and the elderly. Additionally, the industry can worsen access to health care. Many of Dawson Creek's physicians have closed their practices and left because of health concerns in their patients and their own families, worsening ER closures and access to primary care in northern BC. Indigenous communities are those facing the highest burdens of physical, mental, and social health impacts, in particular, Indigenous women. Proximity to industrial work camps is associated with increased rates of gender-based violence, harassment and exploitation, and human trafficking. The National Inquiry into Missing and Murdered Indigenous Women and Girls has clear mandates requiring extractive industries to center the safety of these women and girls. But LNG expansion is proceeding without implementing these mandatory safeguards. I met with 2 remarkable young Indigenous women who live on Gitxsan territory, who questioned why their safety meant so little to the government that they were not considered in decisions on building of the PRGT pipeline. People deserve to have accurate information on whether it is safe to raise their families in their community. And we will only end up costing ourselves greatly in both healthcare costs and physical human health if we do not understand the cumulative impacts of the LNG and fracking industry on our province, which is why I believe we must partner to work with the industry to require and fund an independent, comprehensive, cumulative health impacts assessment of the industry before we sacrifice more of our communities to some harmful health impacts. Thank you very much for your time. Thanks for putting up with me, those of you who've heard from me on this issue before, and I welcome any questions.
Thank you so much for your presentation. We will now turn to questions by members. Recognizing Emiliora.
Thank you so much for your presentation. I'm curious, you didn't attach a dollar amount. Have you folks thought about what that would look like?
There are certainly multiple organizations working together, and as I mentioned, municipalities, the Health Officers Council, who are pushing towards requiring a health impacts assessment. I can't speak to an exact number, and just speaking from my own kind of background as a healthcare professional, I certainly wouldn't be able to attach a dollar amount. And I do think it is important to recognize that the industry, the gas industry, is making profits off of their industry and off of health impacts that are affecting local communities. And I do think that this shouldn't be solely on the province's budget to fund, but that it should be a requirement, and that there should be partnership funding with the industry for them to also participate in funding this impact assessment.
And if a follow-up, you talked about the glioblastoma, so I think it's important to maybe just talk about that a little bit, especially being the fact that it's a rare cancer.
Absolutely. I mean, again, we have some anecdotal evidence such as this, and there have been some biomonitoring studies in northeastern BC looking at the levels of carcinogens such as benzene in biomonitoring studies. So, for example, looking at urine or hair or even air in people's homes that have higher levels of benzene and other carcinogens compared to other communities. So we do have a plausible cause for potentially predisposing people to cancers such as these rare glioblastomas. We just don't have a thorough evidence to actually examine, what are the rates and in what closeness of proximity to these fracking sites. But certainly there is anecdotal evidence there. There are case reports there. The numbers are absolutely much higher than we would expect in any typical community.
Thank you.
Thanks.
Thank you very much. Any other questions? Recognizing Deputy Chair.
Thank you for your advocacy. I'm just wondering, part of this independent cumulative health impact assessment would be to actually compile those cases into some sort of evidence, because as a healthcare practitioner, I appreciate that you're sharing firsthand experience and what you've heard from your colleagues, but I'm hearing that we haven't actually scientifically put this into a study to figure it out. So that is the actual request in layman's terms, correct?
Yes,
okay.
Correct.
Thank you.
Thank you very much. Recognizing Emiliora.
Just a follow-up, you were talking about the closeness by geography too. So obviously if the pipes, for example, are running in the body of water that's right behind people's homes, and then thinking about how many streets up, do you have anything in other jurisdictions that you could just point to? I'm just curious.
Yeah, that's a very difficult question to tease out, which is why, of course, there would be a lot of logistics going into what this assessment would have to look like. Part of it being cumulative is that there are often many fracking wells located in one geographic area. So we have to understand what is the risk of being within X kilometers of one fracking site compared to 2 or 3 or more. And then we also have to consider tailings ponds where the waste products are stored, and are they managed correctly? We also have to consider sites that are even no longer used, and have they been appropriately closed down? And we believe that we can't ever fully remove a lot of these exposures in areas where there have previously been any fracking activity because of the contamination of water and soil. So it is a very difficult question in terms of putting a number limit on how far away is safe enough for setbacks from communities to fracking sites. But at least being able to establish some minimum setback would be better than not having an adequate setback at all.
Thank you so much.
Thanks.
Thank you so much. Any other questions? Seeing none, thank you for coming and presenting.
Thank you so much.
Today.